Hi guys, welcome to my channel. So today we're going to discuss about elbow joint assessment part 2. So in this video we're going to discuss about uh, elbow joint range of motion, manual muscle testing and joint play. So first we go for the range of motion. So what are the movement available in elbow joint? First one is elbow flexion, elbow extension, supination and pronation. So for measuring a range of motion, we have to use a goniometer which have one stationary arm, one movable arm and one axis. Then how to test the elbow flexion and extension range. So for extension, we have to, so patient is in a supine position, place a pillow below the elbow joint. Then the axis of a goniometer is placed on the lateral condyle. The stationary arm is parallel to the humerus, so reference point is the acromion, and the movable arm is parallel to the radius, so reference point is the radial styloid process. Then we measure the range. So normally elbow extension is 0 degree. If some patient having hyperextension, then we measure the range of the extension. Then we go for next is elbow flexion. For elbow flexion, same placement like elbow extension. Patient is in supine, so the axis is in a lateral condyle. The stationary arm is placed on the uh, parallel to the humerus, and movable arm is parallel to the radius. And we measure the range. Normal range is 0 to 135 degree. Then for supination pronation, you have to ask the patient to grip a pen. Then patient is in sitting position, so axis is over the tip of third digit. Stationary arm is parallel with humerus and movable arm is parallel with dorsal forearm. Then we ask the patient to do supination pronation, then we can measure. And so the normal range of supination is 0 to 90 degree and pronation is 0 to 90 degree. Then what are the manual muscle testing? So for elbow joint, so for manual muscle testing we have what are the muscle we are going to test, like elbow flexor, elbow extensor, supinator and pronator. So there is a grading system we have to know about this. Then first we go for the elbow flexor. So what are the main muscles for elbow flexor? Biceps brachii, brachialis, brachioradialis are the primary elbow flexors. So patient position is in sitting position. So humerus is stabilized by the therapist and another hand is on the wrist. So first for grade 3, ask the patient to do elbow flexion, and if patient can do anti-gravity the anti-gravity movement, then it grade 3. But if patient can't do this movement against gravity, then we have to place the patient on a sideline position and ask to do elbow flexion. Then if it can't possible, then we go for grade 1 or only palpation. Then if patient do anti-gravity motion, then we give minimal resistance to the wrist joint, and then maximal resistance. If patient can do do the elbow flexion fully with a minimal resistance, it can grade 4. If maximal resistance patient can do the full range of motion, then it grade 5. Then we go for elbow extension. So for elbow extension, the main muscles are triceps and anconeus. So patient position, patient is in prone line, so shoulder joint abducted 90 degree and elbow flexed to 90 degree. Then we ask the patient, so therapist one hand on the distal humerus and another on the wrist. Then ask the patient to do extension of the elbow. If patient can do it, then in against gravity, then it grade 3. If patient can't do, then we can go for sideline position for elimination of gravity. And if in elimination of gravity patient can't do, then we go for palpation. Then if patient can do in a against gravity, then we go for minimal and maximal resistance like previously, and we can grade it like 4 and 5. So then we go for supinator. So what are the supinator muscle? Like supinator muscle for supination is supinator and biceps brachialis are the main muscle. So patient is in sitting position, arm side, the elbow flex 90 degree, forearm is pronated. Then therapist one hand below the elbow and other hand on the palm. Then patient try to supinate it. Then if patient can do manually, then first against gravity, then we give minimal or maximal resistance. And if patient can't do it, then we go for grade 2 in a sideline, supine line position. We can do supination and pronation. Supination movement in grade 2, and if a patient can't do, then we go for grade 1 on palpation. Then for pronator muscle, so the muscle are involving like pronator teres, pronator quadratus, and flexor carpi radialis. So same position is same like supinator test. So for this, therapist stabilize the distal humerus and another hand stabilize the wrist. Then ask the patient to do pronation. For grade 3 in pronation, it we can give resistance from grade 3. Then for grade 4 we give more resistance, and for grade 5 we give maximal resistance. Because it we can't do against gravity movement of a pronation. It always in a gravity eliminated or towards the gravity position. So in grade 3 also we give resistance in pronator motion. Then we go for joint play of elbow and radioulnar joint. So what are the joint play available? For there is four joint, like for ulnar humeral joint we have distraction and anteroposterior glide. For radiohumeral joint we have distraction and anteroposterior glide. For superior radioulnar joint we have anteroposterior glide, and for inferior radioulnar joint we have anteroposterior glide also. Then I know the grading previously. To grading, first one is the ulnar humeral joint. So for ulnar humeral joint, first one is the anteroposterior glide. So for anteroposterior glide, elbow flex to 45 degree, hold the head of ulna and pull upward for anterior glide and pull downward for um, posterior glide. Then what is the distraction of ulnar humeral joint? Elbow is flexed to 90 degree. One hand stabilize the arm, other hand pull the ulna towards the therapist. Then next one is the radiohumeral joint. So for radiohumeral joint, first one is the anteroposterior glide. So for anteroposterior glide, elbow flex to 45 degree. One hand grip the head of humerus and radius in the thumb and index finger pushed upward for anterior glide and pushed downward for posterior glide. Distraction also, elbow is flexed to 45 degree. One hand of the therapist stabilize the arm, another hand pull the radius towards the therapist. Then for superior radioulnar joint, we have anteroposterior glide. So elbow is 45 degree and hold the radius, and one hand push upward for anterior glide, push downward for posterior glide. And for inferior radioulnar joint, we have there is anteroposterior glide. So distal end of radius and on one hand, and the distal end of ulna push upward for anterior glide and push downward for posterior glide. Thank you.